I am Dr. Tamara or Tammy Grubb. I'm board certified in anesthesia and analgesia. Pain starts out in the pain pathway at the first step, which is transduction. And transduction is activation of a nociceptor or pain receptor by a nociceptive or painful stimulus that can be a thermal, a chemical, or a mechanical stimulus. And that nociceptor is activated, and there's usually a lot of inflammation then involved with this process. It transduces that signal to an electrical signal that's then transmitted. So the next step of the pain pathway is transmission to the central nervous system, and the process of transmission occurs through opening of sodium channels, just like any other nerve transmission. The next step is modulation, and that occurs when that painful stimulus gets to the spinal cord. And we call it modulation because that stimulus is often changed or modified, and unfortunately for the patient, it's often upregulated so that that patient experiences a lot more pain than we would expect it to experience from that initial painful stimulus. And finally, there is perception, where the brain perceives or recognizes that there is that painful stimulus. And it's when that stimulus gets to the brain for perception that we see the affective component of pain, meaning how it makes the patient feel, so meaning the behavior and quality of life changes. Multimodal analgesia definitely is not only the most effective way, but almost the only way to control perioperative pain, especially if that pain is moderate to severe. And what multimodal analgesia means is that we are choosing drugs with different mechanisms of action, or drugs that work at different sites of that pain pathway, so that we're controlling pain at each one of those steps. So to promote normal health in our patients, to promote normal behavior and support of that human-animal bond that is so important to all of us, and to provide our patients with appropriate quality of life and welfare, we have to treat pain.